particularly nowadays, one of the benefits of having your surgery done as an outpatient is you don't have to be around sick people, and that's a real concern. But other benefits really go along with having outpatient surgery anyway, and that is we have made significant strides in dealing with pain. That tended to be the limiting factor that kept patients in the hospital was pain management. And nowadays we use spinal anesthesia almost exclusively for joint replacement. After a spinal anesthetic, the anesthesia wears off gradually, so it's not like you wake up in the recovery room in a whole bunch of pain. We also use multimodal pain management, which is just big doctor words where we give you a bunch of different medicines to try to attack pain from the various pathways that it comes from. And that makes a big difference. It doesn't eliminate the pain, but it makes it much more tolerable so that patients can go home, just take pills rather than IV medicine, and manage their pain effectively. It also allows them to do their rehab more aggressively earlier so they can have a quicker recovery. So those benefits have been extended to Medicare patients now that we're able to do Medicare patients as outpatient. They can enjoy the benefits of less pain, quicker recovery, faster rehab, just like the rest of the population. In order to have the surgery done as an outpatient, you're going to need some support. You're going to have some help at home. You know, somebody's got to drive you, home. So you'll need a family member or a friend, somebody to be there on the day of surgery and to stay with the patient for the first couple of days afterwards would be wise. So if there's, for whatever reason, your family's out of town and you can't gather some support, then you might not be a candidate for an outpatient surgery. Also, this is not being done in a hospital, and hospitals have resources that surgery centers don't. So if we expect the surgery to result in a fair amount of blood loss, if we might have to do a transfusion, we can't do that in the surgery center because we don't have a blood bank. So patients that are maybe more anemic or the surgery's going to take longer, involve more blood loss, those are best done in the hospital setting as well. And then just for patients who have more complex medical problems, we can do outpatient surgery on patients with stable medical problems like, well-controlled diabetes or well-controlled high blood pressure. But if there are multiple medical issues, heart issues, lung issues, things like that, then again, those are best handled in the hospital where we have other medical consultants to help us manage the patient through their surgery.